Welcome everyone to another exciting edition of NeuroConnect, our weekly live event dedicated to unraveling the wonders of neuroscience. Together with eminent experts, we aim to support both patients and caregivers as they navigate the challenges of living with neurological conditions. As we gather for this enlightening event, let us delve into the intricate tapestry of epilepsy, a neurological condition that has not only captivated medical minds throughout history but also has been entangled in a web of enduring myths and misconceptions. Epilepsy, characterized by recurrent seizures, has long been shrouded in societal misunderstanding, giving rise to a plethora of myths that have unfortunately eclipsed the true nature of this complex disorder. From ancient beliefs that linked Caesars to divine punishments to contemporary stereotypes that perpetuate unfounded fears, the myths surrounding epilepsy have cast a shadow over the lives of those affected. Today, we embark on a journey to unravel and dispel these myths, fostering a deeper understanding of epilepsy's nuance, reality, and empowering our collective efforts to create a more inclusive and compassionate society. Welcome to an exploration that seeks to illuminate the truth behind the myths of epilepsy and pave the way for a transformative nature that extends beyond misconceptions to the milestones of progress and understanding. To deepen our exploration into the complexities of our subject today and enhance our comprehension, it is an honor to introduce our esteemed speaker, Dr. Pankaj Jain. With a distinguished PhD in pharmacy, Dr. Pankaj brings a wealth of knowledge and experience to our discussion. His professional journey has been marked by significant contributions to the field of pharmacovigilance, where he played a pivotal role during his tenure at Novartis. Currently serving as a subject matter expert on Inoplexis, Dr. Pankaj Jain continues to be a driving force in advancing our understanding of critical healthcare domains. Please join me in extending a warm welcome to Dr. Pankaj Jain as he shares his expertise and insights with us today. Welcome, Dr. Pankaj.
Thank you. Thank you so much, Deepa, for the kind introduction. It's a pleasure to be a part of this space and a very good opportunity to keep the audience engaged and updated.
Yeah, thank you. Without any further delay, let's now start with today's session. Pankaj, how would you like to proceed? Do you have a presentation to walk us through, or is there another format you have in mind?
Yeah, absolutely. So I would throw light on the neurological disorder, epilepsy, by giving a presentation for sure. Thank you so much.
Okay, great, great. Over to you then, Pankaj.
Sure, sure. Thanks a lot, Deepa.
Sure, thank you.
Okay, hello everyone. So I am Dr. Pankaj Jain. I'm working as a subject matter expert with Inoplexis since last 5 years. So today I would be deep diving into the topic of journey from myths to milestones in the debilitating neurological disorder that is epilepsy. So I hope you can see my presentation. So the agenda for today's topic would be I would talk about introduction, which would be a real life patient story, a patient who's suffering from epilepsy. Thereby, I would cover epilepsy, different seizures. What is the ILAE, that is International League Against Epilepsy, classification of different types of seizures. Then I would cover the misconceptions and the myths that are associated with epilepsy and thereby would present the real facts and thus break the stigma that is associated with the epilepsy. And then I would cover the what are the treatment options that are currently available, as well as the recent innovations which are either developed or which are in the pipeline of the development of in the field of epilepsy. So now, starting with a patient story. So I would talk about Gina's story. So Gina Strudwick, who was a hairstylist, an artist, and an author, she believes that she never would have got back into enjoying art of writing if she wouldn't had epilepsy. So Gina had epilepsy for 4 years. She started having small partial seizures after having her son in 2014. Now, neurologists think that the reason for epilepsy was either the hormonal changes or the lack of sleep. So, Gina didn't have any signs of epilepsy, neither in her family or after even having her son. She is currently on basically anti-epileptic drugs to control her seizures, and is now very happy with how the things are going. So, if you see the statement, what she has put, that Gina said that it's easy to remain negative during the hard times and let epilepsy rule you. She certainly did this for a while, but then she uplifted herself, she made herself happy, she changed her lifestyle and found to be fitness and changed her thoughts. So it's truly inspiring that she believes that her epilepsy had changed her to embrace new career opportunities. So she hopes to have her own salon, a gallery soon, and is proud how far she has come. So such stories are really inspiring, that in spite of having such debilitating condition, you have a neurological disorder, you make yourself uplifted to aspire your career. So that's a very inspiring story that I came across. Then now, talking about epilepsy. So epilepsy is basically a neurological disorder. I can call it as an electric storm that occurs in the brain, which causes recurrent seizures. Now, uh, there is an abnormal and abrupt electrical firing of neurons in the brain, which causes these seizures. Now, the abnormal firing of the neurons, why it happens? It happens because there is an imbalance between the excitatory and the inhibitory neurotransmitters in the brain. So, because of which this firing occurs. So, if I talk about the difference between a seizure and an epilepsy, so a seizure is nothing but it's a symptom of epilepsy, it's a manifestation of epilepsy. Now, a seizure can be because of fever, it can be because of some traumatic brain injury, it can be something because of something else also. So, epilepsy always has seizures, but uh, all seizures are not epilepsy. So, if you see the classification here, seizures are basically divided into groups depending upon where they start in the brain, whether it's one of the hemisphere or one of the both the sides of the hemisphere. Then the next is whether or not the person is aware, there is awareness or not. This is the second aspect, and the third is whether or not seizure involve other symptoms such as movement. So now let's deep dive into the different seizures, which are now called as based on the ILAE classification. So the first one is the focal onset. So when I say focal onset, so there is a specific region in the brain. It is in only on the one side of the brain. So focal awareness seizure. So these were previously called as uh, it was called as partial seizures. In this, the person is basically conscious, aware, and alert, and usually know something is happening and will always remember the seizure afterwards. The next one is focal unawareness seizure. These were previously called as complex partial seizures. In these seizures, basically the person's consciousness is affected, and they may be confused and might not be able to even hear or understand. The next classification is generalized onset. So these were previously called as grand mal epilepsy, wherein both the regions of the brain are involved into the seizures. So the different types of generalized onset seizures are the tonic-clonic seizure. So tonic-clonic seizure is basically, tonic is nothing but it is the stiffening of the muscle, while clonic is the continuous jerking and shaky movement of the muscle. So this seizure most often will recognize whether a person will jerk and shake as the muscles relax and tighten. The next one is atonic seizures, which are sometimes also called as drop tags and tonic seizure. In tonic seizure, basically the person's muscles suddenly relax and they become floppy, and the person they usually fall down or without any muscle tone. So they that is why it is called as drop attacks. And in tonic seizure, the person's muscles suddenly become it becomes stiff and they often fall usually backwards. The next one is myoclonic seizure. When we see myoclonic, so myo refers to muscle, whereas clonic refers to continuous jerk. So myoclonic means muscle jerks, and muscle jerks are not always due to epilepsy. There are some examples wherein people have them as they fall asleep also. The next one is absence seizures. This is most commonly also called as petit mal epilepsy and usually seen in children's. The absence seizures are common in children's than adults and can happen very frequently during an absence seizure. Person becomes unconscious for a short time, and they may look blank and stare, and or even their eyelids might flutter. So apart from this classification, there are again certain epilepsies that are acquired, that may be because of, let's say for example, traumatic brain injury. When there's an insult in the brain, that insult creates a trigger of epileptic seizures, and thereby there's a process of epileptogenesis that takes place, and it causes and also there's a time period wherein there's a latent phase wherein a person will not know whether there's a process of epileptogenesis that is ongoing in the brain, and then suddenly one fine day a seizure comes and the epilepsy develops. So this is one kind of epilepsy. There's another kind of epilepsy called as status epilepticus, which is one of the generalized epilepsy. And in status epilepticus, the seizure lasts for more than 5 minutes, and it's a very debilitating condition wherein a person gets feeds for more than 5 minutes and the body is completely drained out. So if you refer to the next the picture in the adjacent, the seizure types and the recurrence rate. So 60% of the focal seizures are recurrent, while 30% of the generalized are them of them are the generalized one, and the 10% of them are the ones which are of the unknown onset, which I didn't mention about. But the unknown onset is basically the origin of the epileptic seizures is not unknown, and these are the epilepsy or the seizure that would actually are called as the unclassified ones. Now, what are the common myths and facts that are actually prevalent and that is present in the society? So, in case of epilepsy, especially in India, when a person goes through the round of the seizures and epilepsy, people try to sniff onion, people try to sniff snocks, shoes, and they try to put spoon in the mouth. So I think we should have certain awareness about such myths, because these are totally non-relevant and they do not have any cure for epilepsy. In fact, such, for example, putting a spoon in the mouth of an epileptic patient might really create certain trauma. When there's a feed that is ongoing, it might create certain trouble. The patient might not be able to breathe, and it might create certain trauma to the patient. So such myths should be actually I mean, it should. If it is a myth, I think if you're not aware about the myth, you should actually consult a doctor, and then only you should take such actions before you even don't know about such myths. So these are the different myths we can go through one of, all of them. So first one is you will swallow your tongue during the seizure. This is absolutely it's not impossible to swallow your tongue during a seizure. Then epilepsy is contagious. It's not at all a contagious condition. It's somebody cannot catch epilepsy from another person. It's non-contagious. During a seizure, the person is in pain. So during a seizure, a person goes through event of unconsciousness and seizure and don't experience pain as such, but he might drain his energy into the sudden electron, the abnormal firing of neurons which cause seizure. Then next is all seizures involve convulsions. So not really seizures can I mean it be present in different ways. Some of them were are subtle and the person may simply stare or look confused. The next one is video games or strobe light will trigger seizures. So, I mean, there's always some trigger to epilepsy. So, one of them is definitely a light can be a trigger to epilepsy, but it's not the whole trigger for that particular the epilepsy. So the if you see the percentage, it's only 3% of the people with epilepsy here which have these visual triggers. Then next is people with epilepsy are disabled and not able to work. This is absolutely a myth because you already have shared the patient story. The patient was actually uplifted and aspired and went through his dream because of this epilepsy. So that this is absolutely not true that they are disabled and not able to work. So apart from this myths, there are many other myths that are flying around. So I would actually suggest that if such myths come across and if you are really not aware, please consult a physician and then uh, I mean we should be aware about this and then even I have heard about people saying that this is having goddess or having devil in the person. That's epilepsy. So that is also not at all true. So next is moving on to the treatment options. So the current treatment options are enlisted here. So first one is basically the medications. So medications basically involve the anti-epileptic drugs. So anti-epileptic drugs basically these are the drugs which will actually decrease the severity of seizure. It will prevent the frequency of seizures. It will delay the seizure. So there are different drugs that are of choice, which are of first choice, second choice, and alternative add-on drugs. So, for example, in case of generalized tonic-clonic and simple partial seizure, carbamazepine and phenytoin is the choice of drug. Then, in case of complex partial seizure, again carbamazepine, valproate, phenytoin, these are the choice of drug. Then, valproic acid is again a treatment. It is used to treat the absence, myoclonic and atonic seizure. Then diazepam, which is a class of benzodiazepine drugs, which is used in treatment of febrile seizures. Febrile seizures are the one which is developed because of fever, especially in the kids or even in adults sometimes. So, and the last one is the status epilepticus, wherein diazepam and lorazepam are the first choice of drug, which is used in status epilepticus, which is given intravenous. So, if we talk about the mechanism of action of these drugs, so these drugs majorly act either by prolongation of sodium channel inactivation. So, phenytoin, carbamazepine, valproic acid, lamotrigine, these are the choice of drugs which acts by this mechanism. Then the next one is either by facilitation of GABA mediated chloride channel opening, wherein you have barbiturates, you have benzodiazepines, you have vigabatrin, you have gabapentin, tigabin. These are all the drugs which act by facilitation of GABA mediated chloride channel. Then you have the drugs which inhibit the T type of calcium channels current. So the drug in this category are ethosuximide, trimethadone, valproate, and so on. And other than this, there are drugs which act by inhibition of GABA transaminase enzyme, which would, by inhibition of this enzyme, you would actually make the GABA, which is gamma amino butyric acid, more available, and it would create a balance between the excitatory and inhibitory neurons. Then you have NMDA, ampine kinase receptor antagonist. So drugs in this like felbamate, topiramate. These are the drugs which actually so NMDA receptor antagonist would actually if these antagonists are used, so this would cause inhibition of the excitatory neurotransmitter that are released at the synapse. Then we have sp2a protein ligand inhibitor, that is levetiracetam, which causes inhibition of this protein, causes inhibition of release of the glutamatergic neurotransmitter. So these are the different mechanism of action that are uh, prevalent for different medications, and these are the different medications. Then we have the ketogenic diet. So the ketogenic diet is one of the treatment options for children or adults with epilepsy and whose seizures are not controlled with anti-epileptic drugs. So when the medications do not work, so for example, in case of one of the epilepsy, first choice of drug doesn't work, then you give a second drug, which is a second choice of drug. Again, you give an add-on drug. So when you give the first and the second choice of drug and the drug don't work, which is also called as drug resistant epilepsy, the other options become available for treating seizures, which one of them is ketogenic diet. So this the diet may help to reduce this number and the severity of seizures, and it has positive effects. The next one is neurostimulation. So neurostimulation is basically stimulation of particular nerve, and by monitoring the brain waves, you respond to the electrical activity that looks like a seizure, and this will then stop the seizures before they cause the clinical symptoms. And this usually includes the vagal nerve stimulation, deep brain stimulation. This comes into the category of neurostimulation. Then epilepsy surgery is one of the option, wherein different types of surgery, brain surgery, also called as neurosurgery, may help, and wherein what is basically done is the part of the brain which is actually causing the seizures, or it is creating the specific area of the brain which is thought to cause a seizure, surgery is performed and it has been removed. Another kind involves separating that particular part of the brain and then causing the seizures from rest of the brain. And callosotomy is one of the surgery that is done, where the seizures that are triggered from corpus callosum of the area of the brain that has been used. Then apart from these options, the complementary and alternative medical therapies is another option, wherein the yoga and meditation are again one of the options that have been practiced, and clinically it has shown some amount of benefit. So yoga is another relaxation technique that would actually induce relaxation, and it would reduce the stress reduction, and this influence the EEG and the autonomic nervous system, and thus controlling seizures. And meditation, it has been practiced in India and I think across the globe. And the practice of meditation is said to produce hormonal changes, and by mimicking the inhibitory gamma amino butyric acid, it has been hypothesized that the meditation increases the GABA by causing muscle relaxation and reducing the insulin secretion and the ketogenesis and subsequent ketosis. It causes entry of the glutamate, the amino acid substrate, that is GABA, into the synaptosomes. So these are the different treatment options that are currently available for epilepsy. Then, if we talk about the innovations in epilepsy, so when we say innovations, there are certain innovations which are available in market, and there are certain innovations which is still under research. It is either at preclinical, clinical stage, but it has a potential and basically it has a promise for epilepsy. So the RNS system, which is currently available, so it is a responsive neurostimulation system. It is similar to a pacemaker. It's like a heart pacemaker. This is a brain pacemaker. So it works. This RNS system is designed to work by three key ways. So first one is basically it will detect the unusual electrical activity that leads to a seizure. Then, so sorry, first it will monitor the brain waves at the seizure focus all the time. Then it will detect the unusual electrical activity that can lead to seizure. And third one is basically it would respond so quickly within the milliseconds to the seizure activity by giving small burst of pulse or of stimulation. It would help in basically this the goal is to basically help the brain waves return back to normal, and even before it could turn into a seizure. So it is one of the when the resistant epilepsy, and in case of drug resistant, when the things don't work, this RNS system, which is responsive neurostimulation, is becomes a choice. Then the next one is autonomic cognitive rehabilitation training. So this was developed by Dr. Nogai's therapy. In this, basically, the autonomic cognitive rehabilitation training, which is also called as ACRT, it uses both the physiological and psychological approaches to develop skills to control epileptic seizures. Now, this ACRT allows people to see how their body responds to the thinking and the emotion. And by receiving the visual feedback about how their body reacts, they are then able to train themselves basically to become more sensitive to such body reactions and control the body state of alertness. Now, this alertness actually helps the patients to calm the brain and by reducing the incidence of seizures. The next one is basically seizure monitors and devices. So these are the various devices and monitors that are available in market, and these tools can monitor seizure activity and avoid sudden fatalities that has been brought to control the uncontrolled seizures. So a seizure can monitor and can help to basically raise an early alarm. So this devices basically can raise an early alarm and prevent the seizure that will be produced. So some of the monitors and alert devices involve the wearable technology, the smart electronic devices that you wear as an accessory, and uh, for example, like an wearable watch. This watch-based seizure alert devices would actually respond to the repeated shaking movements that occurs during a seizure, and this may basically help and which may indicate that a person is having a seizure. And this can be useful in detecting the tonic-clonic seizure as well as certain focal motor seizures. And by raising this alarm, it would help in taking the also the right medications at the right time so that the seizures can be prevented. The next one is the modulation of inflammatory pathways. So, drugs that actually target the particular inflammatory pathways may be able to reduce seizures and alleviate the related comorbidity. Sometimes the epileptic patients, there are comorbidities that are associated are like cognitive dysfunction. The learning and memory is also impaired in certain epileptic patients. So this inflammatory pathways are basically triggered to this uh, learning and memory, and thus this pathways basically elevating this targeting this pathways would actually help in elevating the symptoms and the seizures, and neuroinflammation has been linked to epilepsy, and it is possible to use the currently available anti-inflammatory medications to treat epilepsy. Then next is the seizure forecasting. Uh, the Epilepsy Foundation's support of My Seizure Gauze, which is an ongoing project, which may lead to development of algorithms for seizure forecasting. So the seizure predictability might even lead to some individuals to stop the medications, self-administrating the treatments only during times of susceptibility. So this AI also, these algorithms can actually help in forecasting when a person can get a seizure. So this technology, which is already in development by the Epilepsy Foundation, would be a real boom if such innovations would reach from the bench to the bedside. So apart from these innovations, there are many other innovations that are still under research, and innovations are happening in the domain of neurology, and I have mentioned a few of them. So hoping that we have certain cure which would actually stop this epilepsy, and some technology or some innovation that comes up which would uh, understand the seizure, understand the intensity of the stigma and the pain that a person is actually going through seizure. So Deepa, that's all I had for today's presentation. Thank you so much.
Thank you. Thank you, Pankaj, for sharing valuable insights about epilepsy, the different myths, and the facts about the myths and the management of epilepsy. Uh, we hope this conversation has been enlightening to our audience, and we truly are grateful for your expertise and the time you have dedicated. Thank you. Thank you for joining the event.
Thank you so much, Deepa. Thank you all for all your time and being an amazing audience. And you can anytime connect with me, and you can post a query. I'm happy to answer your queries. You can post a query on LinkedIn. Thank you so much. Thanks a
Thank you.
lot.
As we conclude this enlightening journey through the realm of epilepsy and dispelling its myths, let us remember that knowledge is the powerful tool we possess in breaking down barriers and fostering understanding. By challenging misconceptions, we pave the way for a more compassionate and inclusive society. Let us carry the torch of awareness beyond these walls, sparking conversations that illuminate minds and dispel the shadows of ignorance. Together, we can build a world where everyone is embraced with empathy and where the light of understanding shines brightly. Thank you for joining us in this crucial conversation, and may our collective efforts continue to create a world where myths are replaced by truth and stigma gives way to solidarity. Until we meet again, let the spirit of awareness guide our path. Thank you everyone for joining us. Have a great day. Take care.